Good day. I am Dr. Edessa M. Pardilagido from the Department of Psychiatry, and I'm going to discuss the mental health program of Bicol Medical Center. This is the outline of my presentation. We begin with the rationale. The Bicol Medical Center shall be responsive to mental health services by integrating mental health initiatives in all human resource and organizational developmental policies and programs to ensure that every employee is consciously aware and sensitive to mental health issues and programs. Bicol Medical Center commits itself to create a workplace environment that promotes the mental well-being of all employees by ensuring that mental health is valued, promoted, and protected. Bicol Medical Center guarantees that mental health conditions are prevented, treated, and that timely, affordable, high quality, and culturally appropriate healthcare services are made available to all employees free from coercion. Bicol Medical Center assures that employees affected by mental health conditions are able to exercise the full range of human rights, participate fully in all hospital procedures, free from stigmatization and discrimination. Second are the objectives. First is to strengthen effective leadership and governance for mental health by formulating, developing, and implementing agency programs relating to mental well-being. Second is to develop and establish a comprehensive, integrated, effective, and efficient mental health program that is responsive to the psychiatric, neurologic, and psychosocial needs of the employees. Third is to protect the rights of employees with psychiatric, neurologic, and psychosocial health needs. Fourth is to integrate mental health care in the basic health services of all employees in the human resource systems and processes by providing policies and practices that promote mental well-being. The fourth objective is to integrate strategies promoting mental health in the workplace by providing information that will raise awareness and advocate opportunities for employees to look after their mental well-being. Sixth is to provide mental health support to all employees by enhancing skills to effectively deal with issues concerning mental health, arranging decent working environment, and extending assistance and advice to employees undergoing mental health difficulty while employed. Seventh is to provide appropriate program for employees returning to work after a period of absence due to mental health problems by facilitating reasonable work adjustments. The coverage of the mental health program shall include all employees of Bicol Medical Center regardless of status, may they be regularly employed, permanent, casual, or contract of service. We now proceed with the guiding principles. First is non-discriminatory. Any employee at risk or identified to have a mental health condition shall not be discriminated in any form, regardless of status, age, gender, or religion. They shall not be discriminated in terms of recruitment, promotion, or termination, nor prevented to receive benefits because of their condition. An employee shall continue to perform duties and responsibilities provided he/she is able to submit certification that indicates that the mental health condition does not impede productivity and that continued work will not aggravate mental health condition. Second is reasonable working arrangement. Employees identified to have a mental health condition who have undergone treatment and recovery as certified by his or her psychiatrist shall not be prevented from returning to work provided the occupational health physician certifies that he or she is fit to work. Division heads, through the employee's immediate supervisor, shall make work arrangements to accommodate employees at risk or identified with mental health conditions. Third is confidentiality. As provided under applicable laws and rules, particularly by the Data Privacy Act, all information and medical records, including those submitted during the recruitment process, shall be protected and treated with confidentiality. Fourth is rights-based. The right to health as enshrined under the Universal Health Rights is promoted, protected, fulfilled through the mental health program. Employees at risk or identified with mental health condition shall not be deprived of the opportunity to work and to participate in policy-making program in relating to mental health. They shall also be able to exercise inherent civil, political, economic, social, religious, and cultural rights. They should also have access to affordable, evidence-based treatment and medical services and to participate in mental health advocacy, policy planning, legislation, service provision, monitoring, research, and evaluation. The fourth guiding principle is sustainability. Mental health initiatives shall be integrated into the health and wellness program for continuity of its implementation. Now are the strategies. First is the prevention, promotion, and information campaign. This could be accomplished by stress management, team building, peer counseling circle, physical fitness, support group for employees with special needs such as lactating mothers or single parents, interest group sharing such as hobbyists, riders, theater artists who could use their particular interest into improving mental health. Other means are production of materials about mental health, regular seminars, symposiums, or fora on mental health for all employees, as well as stress debriefing to employees who have suffered tragic and traumatic life experience. Second strategy is the provision of support and assistance. First is to encourage consultation to our occupational health physician or to the Department of Psychiatry or to their own general physician or a counselor of choice. Second is to consider the possibility that working conditions and other organizational factors may contribute to mental illness and remedy this whenever possible. Third is to identify all workplace stressors and conduct regular risk assessment to eliminate or control the risk of stress as promptly as possible. Fourth is to manage work conflict effectively and ensure that the workplace is free from bullying and harassment or discrimination. Fifth is, in case of long-term absence due to sickness secondary to mental health condition, there should be in place a graduated return to work program. Sixth, if return to the same job is not possible due to the identified risks or other factors, make every effort to identify suitable alternative employment in full discussion with the employee. The third strategy is the treatment and recovery. This includes provision of support to employees with mental health issues at work by providing intervention, treatment, and referral. Second is the conduct of debriefing interventions in case of life-threatening situations or traumatic experience which may or may not be work-related, such as those employees who have experienced natural or man-made calamities. Third is the reintegration into the workplace of employees who have completed mental health treatment. And fourth is the provision of support to retiring employees for easier transition from being employed to unemployed. The fourth strategy is the integration of mental health in the human resource development and management policies and programs. First is to ensure that mental health assessment of an employee is undertaken during recruitment, promotion, and annual physical exam. Second is to integrate mental health awareness session in the new employee's orientation. Third is to provide mechanism to ensure the psychological wellness of its human resource personnel as well as those providing mental health services. Fourth is to ensure that all employees are oriented as to their job descriptions, objectives, and responsibilities, and provide them with appropriate training and adequate resources to do their jobs. The fifth is to set realistic work targets that do not require employees to work for unreasonable hours. Sixth is to ensure that the personnel involved in the recruitment and selection process are equipped with appropriate training and interviewing skills, as well as oriented in the mental health issues and the mental health law. Seventh is to make it clear that individuals who have experienced mental health issues will not be discriminated, and that disclosure of a mental health difficulty will enable both the employee and the employer to assess and provide the right level of support or adjustment. 8 is to ensure all supervisors have information and training about managing mental health in the workplace. The fifth strategy is the establishment of support mechanisms for employees, and one of them is the institutional networks. These include inventory of health institutions within the region that provide treatment and recovery program for people with mental health issues. Second is the mobilization of organized support groups, and the third is the provision of Bicol Medical Center hotline. The second support mechanism is the referral system, which includes protocol or referral of employees with mental health condition from assessment to treatment and return to work. The sixth strategy is the capacity building of mental health program administrators. First is to provide basic education and trainings on mental health for mental health program administrators, as well as provide information and training on how to handle employees at risk or those with mental health condition. The seventh strategy is the review of working conditions, which include the assessment of workload assigned, workload accomplished, as well as the work environment and the job description. So these factors are all interrelated and could affect the performance of the employee as well as the mental health condition. Now for the implementation mechanism of the mental health program. The occupational health physician shall have an initial assessment of the employee at risk or identified with mental health condition to determine the severity of the mental well-being of such employee. Appropriate action based on the initial assessment shall be undertaken by the Human Resource Management Office, which may be, but not limited to, notification of family members on the initial assessment of the condition of the employee and solicit their support in the process, or referral to the Department of Psychiatry for further assessment and management, or to other mental health institution if deemed necessary. Should there be a need for employees at risk for a medical checkup assessment, the occupational health physician shall refer the specialist consultant or to other relevant medical institutions to provide for such needs and treatment as necessary. Should there be a need to undergo treatment, the agency head shall allow the employee the necessary number of days of leave chargeable against his/her earned leave as recommended by the attending psychiatrist. Work arrangements shall be done to accommodate employees who will report to work after treatment. Monitoring of performance and health conditions shall be done to ensure sustainable productivity and wellness of the employee who had undergone treatment for mental health condition. We shall now advance to the responsibilities. First is the medical center chief, who shall ensure the implementation of the mental health program with the following specific responsibilities. Ensure that all established mental health policies are administered and enforced in the workplace. Ensure that the mental health program is integrated in the human resource development and management's policies and processes. Provide resources, including funding, to effectively implement the mental health program. And last is to establish institutional network which can provide assistance in the implementation of the mental health program. Next is the Human Resource Management Office. The mental health program and its activities shall be managed by the Human Resource Management Office with the following specific responsibilities. First is to ensure that the mental health program is integrated in the human resource development and management policies and programs. Second is to provide continuous education and training and initiate workplace discussions on mental health and ensure that all human resources are aware of the mental health program. Third is to maintain contact with institutional networks such as hospitals, agencies, trainers, health, and other professionals to support the implementation of the mental health program. Fourth is to keep up to date with recommended mental health information and educational materials. Fifth is assist in incident investigations, analysis, and preparations of mental health related reports and summaries, as well as keeping records of these documents. Sixth is to monitor and report on levels of sickness or absence related to mental health problems, including stress-related illness, in conjunction with occupational health services and the employees division or department head. Seventh is to establish mental health profile of employees and ensure that records of employees with mental health conditions and those at risk must at all times be managed, kept safe, and treated with confidentiality, conforming with the provision of the Data Privacy Act and Mental Health Act. 8. It is to submit a copy of the Bicol Medical Center's mental health program within 6 months after the effectivity of these guidelines to the Civil Service Commission through the Civil Service Commission Human Resource Relations Office for monitoring, reference, and record purposes. Submit quarterly monitoring report to the Medical Center Chief on the implementation of the mental health program, and such report shall be included in the annual accomplishment report of the Bicol Medical Center. Next are the division, department, and section heads, which are expected to assist in the implementation of the mental health program with the following responsibilities: monitor the workplace, identify hazards and risks, as well as take steps to eliminate or reduce these as far as reasonably as possible. Second is to ensure communication between management and staff, particularly where there are organizational and procedural changes. Third is to assist and support employees who are known to have mental health problems or are experiencing stress outside work, for example, due to bereavement, sickness, or separation. And last is to ensure staff are provided with resources and training required to carry out their job. Next is the Bicol Medical Center Union of Employees, which is expected to partner in the mental health program with the following specific responsibilities: collaborate with the Medical Center Chief in the Human Resource Management Office or the unit in charge in the development, administration, implementation, and monitoring of the mental health program. Second is to provide support and assistance in developing strategies, administration, information dissemination, implementation, and monitoring of the programs and activities on mental health initiatives. We now proceed to the communication plan. Bicol Medical Center shall adopt and implement a communication plan to promote the mental health program through the use of available media. Information and educational materials shall be made available, and activities may be conducted to facilitate the dissemination of relevant information on mental health. For the monitoring and evaluation, a quarterly monitoring report shall be submitted by the Human Resource Management to the Medical Center Chief on the implementation of the mental health program, and such report shall be included in the annual accomplishment report of Bicol Medical Center. The effectiveness of the mental health program could be gauged through staff complaints, accidents at work, staff sickness levels, staff turnover, the use of occupational health or counseling services, employee survey, early retirement through illness, or exit interview. The BMC shall allocate and incorporate funds and resources in their annual work and financial plan to support implementation of the mental health program. Thank you for your attention.